Good morning. Thank you all for joining us today for this second dose vaccine gathering. I'm especially grateful to our faith leaders for lending us their arms and their voices so we can continue to share with all of Arizona the importance of the COVID vaccine and how important it is for all of us to roll up our sleeves and get our vaccine when our turn arrives. I'm especially grateful for Dr. Warren Stewart for once again lending us his voice and his beautiful church so we can come together to get our second doses administered today. I'm extremely grateful as well for Dr. Kara Christ and her entire team for their tireless work to continue to deploy the vaccine throughout our state and work tirelessly to help keep people as safe and healthy as we can as we work through this pandemic and into hopefully some light at the end of this tunnel with the vaccine. Dr. Christ.
Thank you, Maria. So 3 weeks ago today, I had the pleasure of vaccinating the religious leaders who are joining us today. Today, I'm happy to complete the cycle by administering the second dose of Pfizer vaccine. More than 1.5 million doses of COVID-19 have been administered in Arizona to over 1 million people. The leaders with us today joins hundreds of thousands who have received both doses of COVID-19 vaccine. Arizona continues to make great strides in vaccinating people against this virus, but there is still a lot of work that needs to be done. Next week, a much-used vaccination site in the East Valley becomes the 4th state vaccination site. This positions us to vaccinate many Arizonans quickly and efficiently when our supplies permit. I really want to thank Maria and Dr. Stewart for having this event. Every person who has received the COVID-19 vaccine demonstrates their confidence in the vaccine's safety and effectiveness. When that person has a position of influence in our community, especially with underserved population, that impact is even greater. I was moved by everyone's comments at our last event with clergy, and I'm looking forward to hearing what everyone has to say today and to hear about their experiences. Events like these allow us to look forward to the day when vaccines will help us return to a more normal way of life, of being together in houses of worship and other settings. When your turn arrives for vaccination, please follow the example of those here today and take it. As with many vaccines, some of those being vaccinated today may feel some side effects. These can include pain at the injection site, fever, fatigue, headache, chills, and muscle and joint pain. It's important to note, though, that these side effects are normal, and it signals that your body is producing an immune response. When I received my first dose, I was very lucky. My only side effect was normal soreness at the site, and the same thing for my second dose. So please, when your turn in line arrives, please get vaccinated. These vaccines are the light at the end of the tunnel, and they are one of the most effective public health tools we have for fighting disease, whether that's influenza, measles, or whooping cough. I am grateful to Dr. Stewart for being our host pastor today, and I'm going to invite him to the microphone.
Good morning, and thank you very much for your presence. Thank you, Dr. Chris, for coming back to us at First Institutional Baptist Church. Thank you, Director Fuentes, for partnering with us and the Department of Health. This is like Christmas in February. To get the first and the second shot in the same month, we are so appreciative of this. But this also is an example of the intersection between faith and medicine. It has been proven in all major religions that there's a connection between spirituality and one's health. And so that's why we as clergy, as faith leaders, are just extremely thankful to God for our Department of Health Services, for our Governor's Office of Youth, Faith, and Family, who have partnered with us together to see the intersection with faith and medicine to combat the deadly disease of COVID-19. I took my shot 21 days ago right here. I've had no side effects, no pain, and I'm looking forward to the second shot. So thank you very much, and the faith leaders encourage all people to trust God and get your vaccination shots. Thank you.
Thank you, Pastor. Thank you so much. Now we're going to invite Rock Arnett to get his second dose of vaccine and share some words. He's the representative of the Church of Jesus Christ of Latter-day Saints.
Good morning. What a delight it is for me to be here for this second shot. Absolutely thrilled, and thank you, Pastor Stewart, for bringing us all together and making this possible, and to the health department and Dr. Chris. This is wonderful. I too didn't feel anything with your shot last time, and couldn't hardly believe that it was already over, and I didn't have any side effects. So let me, as I reiterated the last time I was here, the senior brethren of the Church of Jesus Christ of Latter-day Saints have all been vaccinated and received the COVID vaccination, and encourage those to consider in the faith that are eligible to also receive the vaccination, because it's appropriate and proper and a good citizen to do so. If there's some question as to the efficacy in your mind, we encourage you to check with your doctor and professional help to realize that this is in fact the right thing to do. And so congratulations to everyone, and I'm delighted to receive my second shot. Thank you.
Okay. Up next is Pastor Larry Farley. He's the lead pastor of Global Outreach 360.
Wow, this is the second vaccine, and since that time I've had a chance to really talk to probably hundreds of people in the work that I do who have received the vaccine or has worked as a volunteer at one of the sites. And something that's consistent through everyone I talk to is the level of excellence that these vaccines are being administered. The other thing is the volunteers that's served in some of these sites have all consistently said the same thing. They're just highly impressed with the process that has been established. I just can't commend the governor's office, all the health professionals, and churches that have promoted this vaccine. For me, I think we've all received excellent information to be aware of the vaccine that will allow anyone to make a very wise decision to get the vaccine. And so, with that, we continue to thank you for the excellent job you're doing. So. I don't know why. You know what? We can share it. Absolutely.
All right, now we have Reverend Al Beasley, who's the pastor at First Christian Church of Globe.
Good morning. As several COVID-19 vaccines make their way to the general population, we have hope for containing and perhaps defeating this coronavirus pandemic that continues to ravage the world and our country. If enough people are vaccinated, scientists say the virus will have nowhere to go because there will be few susceptible hosts left to infect. This is the surest and safest way of achieving this herd immunity without losing countless more lives. It is the right thing to do, and get vaccinated when it is your turn.
Next up is Pastor John Martinez of the New Beginnings Church.
Dios me los bendiga a cada uno de ustedes en esta mañana. No se preocupen, no estoy aquí representando los Phoenix Suns, ¿ok? Porque traigo mi playera de esta, ¿ok? Vengo representando la comunidad hispana. Es mi segunda vacuna. No recibí ningún síntoma, me siento bien. Quiero animar que todos los hispanos, por favor, tomen esta vacuna. Es para mejorar nosotros. Tenemos nosotros como hispanos de salir de este miedo y saber que esto es para nosotros. Hemos mirado que los números están ya declinando. Quiere decir que esta vacuna está trabajando, practicando la distancia social, usando las máscaras, haciendo todo lo que se necesita. Estamos haciendo esto. Y nosotros como hispanos tenemos que ser los que seguimos adelante y ser el ejemplo a todos los hispanos que esto es bueno para nosotros. Estamos aquí para vencer esta pandemia. Estamos aquí para mejorar nuestra comunidad, nuestro estado, nuestra nación. Que Dios me los bendiga, Dios me los guarde y Dios siempre esté con ustedes.
Gracias, Pastor Martínez. Pronto ahora introducir al reverendo Enrique Cadena, representando a la diócesis episcopal de Arizona, the Episcopal Diocese of Arizona. Reverendo Cadena.
Before the terrible news that we received that in this country we have crossed the 500,000 deaths, it is very important for us to continue this effort of bringing a good life for everybody. I like to invite all the Latino community especially to really put themselves up there in the line as soon as the vaccine is ready for them. Así es que invito a todos ante esta noticia muy fuerte de que hemos cruzado el 500,000 de habitantes muertos, que sigamos luchando y haciendo todo el esfuerzo para que seamos capaces de frenar este virus. Y invito a toda nuestra comunidad latina a que estemos dispuestos en cuanto la vacuna esté disponible.
Now we invite Dr. Benjamin Thomas Sr., who is pastor and senior minister at Historic Tanner Chapel of African Methodist Episcopal Church.
Good morning, and I too am delighted to be here. Thank you, Dr. Stewart, for hosting us for this great event. It is important that as a member of the faith community, that the community sees us stepping up to take on leadership. And so today, I am delighted to take my second shot as we encourage people of our community and our city and our state, those that are available and willing to receive the vaccine, to take the vaccine. As I step out on faith, I encourage you as we pray for you and with you as a community of believers. You ask me why would I take not only the first but the second shot? Because I want you to understand that the vaccine works in two parts. The first vaccine and the second vaccine. One is not any better without the other. We need to receive both. You say, why? I tell you why. In the words of Hezekiah Walker, I need you. You need me. We're all a part of God's family. Stand by me. Agree with me. We're all a part of God's family. I need you. We need you to survive.
And finally, we invite up Pastor Gary Kinnaman, former senior pastor of World of Grace.
Well, good morning, everybody. I just want to say something about the volunteers who have been helping, from the governor's office to the football stadium. My wife got her first shot a week and a half ago out at the football stadium, State Farm Field, Cardinal Stadium, and I just was blown away by the way it was organized, all the people that were assisting, the friendliness of the volunteers. We didn't know if they were volunteers or paid, but they were all fantastic. And the reason I want to say this is because there's so, when something goes wrong, that makes the news. God bless all of you people in journalism, but that's what makes the news. That's what people want to read about. But I was just so impressed. Somebody had to put this together. Somebody had to train the volunteers. And it was just hundreds and hundreds of people out at the stadium. They're going 24/7. It really is remarkable. And, for all the bad stuff that we hear, there are so many good people doing so many good things. And I'm grateful for that. And I'm grateful to be able to do this, to get a shot on TV. All right, so now I'm going to have to undress. I wore another white shirt, and she said, we're done with the last.
Yes, you're the last.
I was hoping to show you my tattoos.
I love it.
There, how's that?
That is perfect. Thank you.
Thank you, doctor. Can I go to that ambulance now?
There is.
Yeah,
They're
okay.
watching over you.
Nice to see you, Maria.
Good to see you, Pastor.
Thank you.
Thank you so much. And so that is our last shot for today. So I think with that, if we're going to take some questions, Kara?
Yeah, we're happy to take any questions. Oh, yeah.
Hi, Dr. Chris. This is Daniela Zavala with Univision. So I have been monitoring the website, and it seems that still the Latino community has been very affected, one of the most affected during this pandemic, and yet we're one of the less vaccinated, in 8% I saw this morning. What are the plans for the state to reach our communities? I mean, I see the leaders here, the religious leaders, are their plans to, for example, do vaccinations in churches? And if so, when? And the other question is, we see that the portal to register is in Spanish, but when you put where to find the vaccine, it's not in Spanish. Is that changing?
Yeah, so that is a great question, and we continue to translate all of our assets and websites into Spanish. That has been a priority. We're actually looking at redoing our COVID-19 webpage right now, and that will be both in English and Spanish. And we are reaching out to our communities. Last night, through our partners, we held a telephonic town hall with members in the 85009 zip code. That town hall will be repeated tomorrow in Spanish, and we'll be doing it again in a couple of weeks. We anticipate expanding that program, but also providing outreach and registration assistance to those that may need assistance with that. We're also going to be partnering, as we get more vaccine, trying to get more community-based and local vaccination sites. So places like community colleges, churches, where people live nearby, to make sure that there's not a barrier due to transportation or something, and that they feel comfortable to go get vaccinated.
Hey, Dr. Chris, Mike Peldon, ABC 15. I appreciate you taking the time. A couple of questions, I'll ask one at a time. We know there's varying opinions on if we will ever truly reach herd immunity. Right now, 438,000 people in Arizona have been fully vaccinated. So what target number are you looking for, and that would lend itself to people at home feeling more comfortable venturing out and returning to some sense of normalcy?
Yeah, so what we're looking at right now is trying to reach about between 70 and 80% in order to get that herd immunity. Again, we learn so much about this virus every day. With measles, we really want like a 94, 95% vaccination rate in order to ensure herd immunity, but that's because measles is highly infectious. This is somewhere in between influenza and measles, so we're trying to get as many vaccinated. It likely won't occur until this summer.
And with the news today on the Johnson & Johnson vaccine clearing an approval hurdle deemed safe and effective, when would you anticipate then those vaccines making it to Arizona, and how is that going to change the rollout in our state?
Yeah, so we are very excited about the Johnson & Johnson vaccine. This is a one-dose vaccination. We anticipate it as, if it goes through the entire process over the next couple of days, it will finally get an ACIP recommendation. We anticipate having it in Arizona next week, as quickly as that. So we're continuing to follow the path through our federal partners, and then we are looking at trying to get it out. We know that there's not going to be a lot of Johnson & Johnson vaccine at first. It's going to take a while to ramp up the production, but looking at where are the best places to get that out to.
And my last question, I know you're asked this all the time, but with the news of the Johnson & Johnson vaccine today, I think a lot of people at home are just wondering, general population, at this point, would you anticipate anyone who wants a vaccine will have the chance to get it?
Yeah, so that's a really good question. And we know that the vaccine supply is supposed to ramp up between March and April. So we should start seeing significant increases in the vaccine. Hopefully April or May, we would be able to bring in the general population. But as we continue to get more vaccine, we're going to continue expanding through our eligible groups. Yeah.
Hello, Dr. Chris. Peter Seymour, KTAR News. Good morning.
Good morning.
Quick question. Will there be a comprehensive list of occupations that of the eligible recipients whenever the state moves to full phase 1B? When will that be available? And if it's not available now or soon, when will it be finalized?
Thanks. So our Vaccine and Antiviral Prioritization Advisory Committee met on Monday, taking a look at what other lists states had put out, comparing that to the ACIP recommendations, as well as state-specific information like our executive order for essential workers. We've come up with a pretty broad category. Categories. What we would recommend is we are going to put a list together that will be ready before we move into phase 1B as a state. But what we would recommend is if you don't see your specific profession on there, but you're within the transportation, industry or the energy industry or one of those industries that's listed, to ask either your local health department to see where they are prioritized and if you fit under there, because it's going to be impossible to get everybody's specific positions and titles, but there's going to be broad categories that'll be eligible.
It'll be county by county for now, and no time frame as to more specific guidance from the state or even from counties at this point. Am I understanding that correctly?
Yeah, so some of the counties have moved into Phase 1B and are already doing essential workers. As we continue to look at the proportion who have been vaccinated to see if we can move into the next phase, we'll be working with Maricopa and Pima counties to identify when they're planning on doing that.
Today, as you know, Kathy Hoffman will be holding a news conference about 90 minutes from now talking about reopening schools possibly. What conversations have you had with her recently, and what are specific recommendations that you have made for schools to reopen safely, if they're indeed going in that direction on a wider basis in the near future?
Yeah, so the Centers for Disease Control and Prevention just came out with recommendations for reopening schools. My team is taking a look and seeing what their recommendations are, what the mitigation strategies they are recommending, and going to make recommendations. I was speaking with the Department of Education this morning, and so they're very excited about the mitigation strategies. They want kids back in school, and they want schools to be opening safely. So we'll continue to work together with them on that guidance as we get it developed.
I suppose we'll have more questions for you on this once they make their announcement today as well, but thank you for that.
Yeah, thank you. Is that it?
Actually, you know what? If I'm the last, I'll keep going. I have a couple more. Let's see. Any updates on vaccine delays now that the weather is better across the country? How are we getting doses of Moderna and Pfizer right now? And is that delaying movements to the next phases, or are we still on target for most parts of the state?
So we are on target for most parts of the state. There are a couple, so we received our Pfizer doses at the end of last week, and this week we've received our Pfizer doses. So the Pfizer is still on track. There may be a couple of shipping delays with some of the Moderna depending on the distributor, but it does look like that vaccine that was scheduled to arrive last week, as well as this week's vaccine, should arrive this week.
We're making up time. Thank you.
Yeah.
One last question, since
Sure.
the new East Valley state-run pod. My understanding is when that transitions to a state-run pod, it's going to start out 7 to 5, about 2,000 appointments a day, but eventually has the capacity to be a State Farm Stadium, 12,000 a day. When would you anticipate that pod being what State Farm Stadium is, 12,000 appointments a day?
I would anticipate it's still going to be a while before we are with that fourth pod anywhere close to State Farm Stadium. So likely what you would see is State Farm Stadium is still not at the capacity that we would like it to be at. We still have room to add appointments. Then we'd look at Phoenix Municipal Stadium because that one's been operating for quite a while. It has the same capacity that State Farm does. So increasing there, and as well as down at U of A. We want to make sure that we've got a site running and that it's efficient before pulling it to the capacity of State Farm. So that would probably be one of the latter ones that would move.
So by a while, is that weeks, months? What would you guess?
I would probably say end of March, beginning of April, if that happens. Again, it's all dependent on the vaccine supply.
Thank you.
Yeah.
Hi, Dr. Chris Lorraine with the Copper Courier. You had just mentioned that the state is looking at the percentage of people that have been vaccinated in the current priority groups before you kind of consider moving on to other essential workers in Phase 1B. Is there a recommendation or target number that the state looks at before it decides whether to proceed? I was hoping you could talk a little bit about that.
So what we do is we've got population estimates for each of the phases that we're kind of using as like to identify where we think we are. And so in working with Maricopa County, they look potentially at around 50 to 60% of that phase's target before moving on. We continue to look, and we do know that those estimates aren't perfect, and they also aren't mutually exclusive. So you could be 65 years and older, but you could also be a healthcare worker that was vaccinated in 1A. So we know that, and we're trying to take that, but knowing that about 55% of the people before the data even came out were willing to get the vaccine, we've kind of targeted on that. Now, that could also play a role in, as we open up more appointments, if the demand's not there, moving forward to fill those appointment slots. So we're using all of that.
Perfect, thank you. And one last question. We had heard over the weekend that at the state's Phoenix Municipal Stadium site that there were individuals who were able to kind of drive up or walk in without an appointment to be vaccinated. I know you discussed kind of the idea of +1s when President Joe Biden had done the virtual tour earlier this month, but can you talk a little bit about why the state would maybe open up appointments or open up vaccine allocation to people who didn't have appointments, and kind of how the state decides who to give vaccines to in those instances?
Yeah, we heard that too this weekend. So we do know that we were doing our +1s. So those that arrive and are able, are eligible, or they're in an eligible category, we do try to vaccinate those individuals. But we're not sure where that rumor started.
Sure.
Because
okay.
we were doing Phoenix Municipal just like we have been. So, but I had gotten actually texts like, I hear I can just walk up and go get vaccinated. And I'd be like, no.
Gotcha. So is there, no situation, I guess, where if the sites are noticing they have a surplus of vaccine, that they may, start, taking in people who don't necessarily have appointments?
Yeah, so there's a couple of strategies that I can only speak to the state sites, but there's a couple of strategies that we use to make sure that we are getting vaccine out efficiently and it's not going unused. We do offer the +1s, and that's kind of that clinical decision. Do we have the vaccine, and do we have the capacity at that time to take in? Adding a walk-in or like a +1, they're in our system kind of as walk-ins, thinking like if you were doing a clinic, people may just walk up. It adds about 10 minutes to the process. And so we look and see how the capacity is flowing. Do we have the additional vaccine? And how many appointments do we have scheduled for either the rest of the day or until the morning? And do we have the vaccine supply that we're going to need? They will make those types of decisions. And then they'll also make, on the spot decisions about like if they do have somebody just show up, and is this somebody that we would like to get vaccinated? Like, are they 80 and drove 10 miles to come over? So they will look at that, and then they'll also look at like if they've got a number of doses at Phoenix Municipal Stadium, they've got lists of nearby eligible organizations that they can call to invite people to come down. But we always have the option of any unused doses can go to State Farm, because with the 24/7, we don't have that same issue at the end of the day. There is no end of the day. We just continue using the doses.
Perfect, thank you.
Yeah.
Hi, Dr. Chris. It's Daniela Zavala from Univision again. And I think you addressed this a few weeks ago, and it's regarding some things that has been reported in other states, and there were some concerns here also in Arizona. And it's about people coming from out of the country to vaccinate. This fact they, don't live in Arizona, regardless their immigration status, they live here. You say that they can get vaccinated, but how about, those incidents that were reported in other states, and there were some information that was also happening in Arizona. Any update on that, or any actions that the state is taking to make sure that goes to the people who live in the state?
Yes, so part of our mission is to make sure that we keep Arizonans healthy, and so we want everyone to stay COVID-free as much as possible. But viruses don't understand residency. They don't know if you're from Arizona or not from Arizona. And somebody who is here in Arizona at this time has the risk of catching COVID-19 and transmitting it to others. They're still part of the community. So we want to make sure that we are protecting everybody, and by doing that, that's getting vaccine out to those eligible populations. And so we have been, if you are in Arizona, we have not been requiring residency to get vaccinated. And we would hope that other states, offer and afford Arizonans that are in those states the same benefits that we're offering other states' residents here.
Last question. So back to schools. I know we're talking about masks and hand washing and good hygiene, social distancing, staying home if you're sick. And of course, we have the school benchmarks for which ones should open and which ones should close, for the recommendations. Anything beyond that, specifically, that you've given to Kathy Hoffman and the education community?
We've been working with some of the districts and in partnership with the Department of Education and ASU on a Healthy Kids, Healthy School campaign. So there are social media messages that we'll be releasing. We are also working on piloting testing with some of those districts as well for both the teachers as well as when the students return, do we have, are they interested in potentially doing tests, like surveillance testing of students? So we do continue to work with them on different initiatives. And so hopefully, I'm a huge advocate for kids being back in school, just given all of the benefits and the learning that takes place. All right, well, thank you, everybody, and we hope that you have a great rest of your day.